this is the pelvis of a regular person walking down the street. This is the pelvis of a very pregnant person walking down the street. Now picture their tummy is out here, and that causes the back to sway just a bit to compensate for that pressure that's out here and the weight that's leaning her forward. So it tilts her pelvis a little bit like this. But also what it does is it creates a little stretch back here in the back. That's why you'll see pregnant ladies that go, oh, my back. They want to rub right there because there's just constant stretching right there. Well, there's really nothing mom can do to relieve that stress and that stretch that's happening in the back. But there's something we can teach a partner to do, and that is what we call knee press. And that is where we take, and we'll show you the technique in a minute, but we take mom's knees and you use this part of your hand right here, and you will press on her knees under the kneecap. It's really important that your hand, this part of your hand, is under the kneecap, or it won't be pushing in the right place. And then we'll show you how you do that. And you press on her femurs, and it pushes this back up and sets her pelvis right. Gives her just enough relief that she just feels fabulous. And if she's very, very pregnant and has a lot of stretch back here, you'll see it on her face. She'll just go, oh, feels so fabulous. So watch for that. And if she's not that big, if she's just tiny little tummy, she won't have so much stretch here. She'll still say, yeah, well, I feel that, but it doesn't cause the relief because she doesn't have the stretch in the first place. So in a few months, she probably will have. So that's what we tell them. Most important thing is to get down to the level so that your arms are going right into the same direction that her legs are going. So you get down low like this, and then you just lean. You can always tell if you're doing it right when mama makes that face. Now sometimes, I'm going to let you down now. Sometimes if her tummy's not as big and she doesn't have that stretch in the back of her pelvis, she won't have that response. She'll just go, well, okay, you pushed my femur back into my pelvis. But when she's got stretch in her back from the weight of the baby in the back trying to compensate for that, this is relieving that stretch. And even after we let her down, she still feels some relief because it's like a rubber band that's been stretched really far, and then when you release that, it just still feels better. When it goes back to where it was. If you do this right, all you have to do is lean. You want your arms locked straight, so you just lean. That way you can stay here and watch TV, I guess.